Hey y'all, my name is Rachel Belkey and I am part of Group 2 for our nursing group Wiki project, and we did jobs in nursing.
I'm Margaret Blinko, and we all explored different jobs, all the way from old people to those in jail.
I'm David Berryhill, and we enjoyed the opportunity to work with each other and learn more about each other and working with this project.
I'm Laura Beer, and come check out our Wiki project. I hope you like it, and I hope you. Guys, I ruined
No,
it.
it's okay. It's okay. Just keep going.
And I hope you guys enjoy it and learn more about jobs in nursing. Hi, everyone. I'm Laura.
I'm Rachel.
And we did our group Wiki project on jobs in nursing. I did my portion of the project on geriatric nursing because I've worked in geriatric nursing for the past 4 years as a resident care associate, and I learned a lot working with geriatric nursing, and it made me want to do my project on it because I wanted to learn more about it. So doing my project, I came across some things that I didn't know that I struggled with, like all the different types of geriatric nurses and the different levels, and when you get to a graduate level you become a different geriatric nurse than as if you have an RN, and I kind of struggled with that because when I was looking for geriatric nursing in researching, it was all different kinds and I couldn't find exactly what I was looking for, so it just made it a little bit more difficult for me, but the benefit of it was that I also did get to learn about all those different kinds, and I also got to learn about just the different ways that elderly are treated in nursing home other than what I have experienced, and I also got to learn about all the different types of work settings. I mean, I worked in a nursing home, but you can also work at a home healthcare setting, or you can work in a facility like a rehab facility. But overall, I really just acquired so much more knowledge than I already knew about geriatric nursing.
I did pediatric nursing because in 2008 my brother was diagnosed with leukemia, and ever since then I've been exposed to a lot of nursing associated with children, and also pediatric nursing combines my love of children and healthcare. So I wanted to learn more about what I'm going to be doing in the future. I would have to say some difficulties with this is finding the exact salary for this, like the specific descriptions, because there are so many different kinds, like oncology, working with children, with cancer and all that different stuff. I would have to say the benefits are definitely, would definitely have to be just being able to just prepare myself for what is going to come in the next 3 years since I'm only a freshman, and also I think that just actually also this made me more comfortable with how to actually do a wiki, because before when we did our personal wikis I just kind of followed this step by step, but with this we got to be a lot more creative and actually work with others to be able to learn and do more things with the technology and everything. So yeah.
Hey, I'm Margaret Blinko.
Hi, I'm David Berryhill, and we're doing the second part of the Group 2 Wiki project.
Based on jobs in nursing.
I did psychiatric nursing. I've always enjoyed psychology, so this was a great choice for me, and it's very personal for me because my aunt had bipolar disease, and she also had a lot of complications with healthcare, so I hope that I can do a better job for her as well as other patients that have mental illnesses. My grandma is also dealing with Alzheimer's, so that's 2 members of my family that have had to deal with psychiatric nursing or psychology, and I hope that for both of them and for other patients I can provide great care for them. My main issues with this project was trying to find a unified salary for this practice, and I also had trouble finding one source to choose from because there were so many. So it's a good thing and a bad thing, but in some ways it made it hard, in some ways it made it very easy. I very much so enjoyed looking at this career as a possibility for what I want to do with my life. There were so so many options and so many opportunities that it was very interesting. And I am definitely thinking about continuing this. I also enjoyed being able to play with the Wiki technology.
And I chose to do correctional health and nurses that work in correctional facilities. I chose it because I've always had a fascination with jail and everything that goes on behind bars. I didn't have any challenges because this field is small, but it is growing. It used to be viewed as a dangerous field, as a field that nurses went into when they couldn't find work elsewhere. However, that was the past, and it is growing. The benefits I found as working as a correctional nurse is that you have a sense of autonomy because you work most of the time crazy hours where doctors aren't there, so you have the independence to administer drugs and help to people at crazy hours with crazy diseases because they've never had medical attention, so their disease can be very progressed, and you are the only one there that can help them. And also, you see these patients day after day after day. Unlike in a hospital setting, when you see a patient for an hour or so at a time, you see these people day after day after day to administer them medication. I enjoyed this opportunity to make my own wiki, to explore a career that interests me because, as I said, I've always had a fascination with those that live on the wild side and helping those that are less fortunate. We should see these people as patients first and inmates secondly. So,
Yeah. All right.
Thank you.
Say bye, y'all.
Bye.
Okay, I gotta find it. Or